Carrie is a first-time mother caring for her new baby boy. She notices that as she touches his cheek, he turns towards that side and opens his mouth. The nurse tells Gary that this is a reflex called dash. A. Plantar grasp. B. The rooting reflex. C. Palmar grasp. D. The Moore reflex. E. The Babinski reflex. The answer is B. The rooting reflex. The question describes the rooting reflex. The Moore reflex is shown when an infant is startled and or feels loss of support as if he or she is falling. He or she will extend the arms above the body in a curved shape. The Babinski reflex occurs in response to stimulation of the sole of the foot. Typically, the large toe will extend or remain extended as the others move. Infants may also exhibit plantar grasp with application of pressure to the foot. In plantar grasp, the toes will flex inward. Infants displaying palmar grasp will close their fingers around an object placed in their hand. Which of the following findings are abnormal upon assessment of an infant on the third day of life? A. Mottled skin. B. Firm stools. C. Blue tint to the hands and feet. D. Fine hair covering large body surfaces. E. Small, white spots present on the bridge of the nose. The answer is B. Firm stools. Hard or firm stools are abnormal for an infant on their third day of life. Typically, infants will have meconium, dark, sticky, stools for the first several days as a result of amniotic fluid ingestion. Over the next couple days they will transition to a seedy yellow, breastfed infants, or peanut butter consistency, formula-fed infants. Acrocynosis, blue color on the extremities, is normal in infants. Mottling is also common. Infants have a developing cardiovascular system and many capillaries that exist close to the surface of the skin. Milia are normal white spots that frequent the faces of newborns. It is important not to pick or scratch these white spots to prevent scarring. Infants are also frequently born with fine hair called lanigo covering the body's surfaces. Some babies may be born with more lanigo than others. While assessing a 4-month-old infant, the nurse notices hyperpigmented nevi on the lower back. Which of the following is false regarding hyperpigmented nevi? A. Hyperpigmented nevi fade over time. B. Hyperpigmented nevi are most commonly found on dark-skinned children. C. Hyperpigmented nevi are frequently mistaken as bruises. D. Hyperpigmented nevi may be scattered. E. Hyperpigmented nevi may be associated with Sturge-Weber syndrome. The answer is E. Hyperpigmented nevi may be associated with Sturge-Weber syndrome. Hyperpigmented nevi have been previously called Mongolian spots. They occur most commonly in dark-skinned children and fade as the child ages. They are often mistaken for bruises. Sturge-Weber syndrome is a neurological disorder which is present at birth and associated with port wine stain birthmarks. While using an otoscope, how does the practitioner correctly examine the tympanic membrane of a toddler? A. Pull back on the upper pinna. B. Pull forward on the upper pinna. C. Pull down on the earlobe. D. Pull upwards on the earlobe. E. Pull up on the upper pinna. The answer is C. Pull down on the earlobe. Examine the eardrum of infants and toddlers by pulling down on the earlobe. Examine the eardrum of an older child by pulling up on the outer pinna. Additional help from colleagues or caregivers may be necessary when examining small or upset children. Rubeola is caused by which of the following viruses? A. Varicella zoster. B. Measles. C. Human herpes virus. D. Coxsackie virus A16. E. Parvovirus B19. The answer is B. Measles. Rubeola is caused by the measles virus and is extremely contagious. Airborne precautions must be used when measles are suspected. Patients who are affected by measles may exhibit a high fever, cough, conjunctivitis and a rash among many other symptoms. Contraction of measles may be prevented by administration of MMR, measles, mumps, and rubella, through vaccination. Human herpes virus include a family of related viruses of which varicella, zoster virus, causes chickenpox and shingles, is a member. Parvovirus B19 may cause fifth disease, among other conditions. Coxsackie virus A16 causes hand-foot-mouth disease. Which of the following would be considered appropriate in the treatment of a child with Lyme disease? A. Restricted fluid intake. B. A clear liquid diet. C. Contact precautions. D. Promotion of bed rest. E. Administration of antibiotics. The answer is E. Administration of antibiotics. Lyme disease is caused by the bacteria Borrelia burgdorferi. It is a vector-borne disease that is contracted secondary to the bite of an infected tick. Administration of antibiotics is crucial to recovery. Standard precautions are adequate. Restricting fluids, diet, or activity is not necessary. A mother calls the clinic because her son is 5 years of age and has been experiencing incontinence of diarrhea for 3 days. He has a past medical history of constipation. The physician has diagnosed the child with encephalitis. The nurse may recommend the family try which of the following? A. Restricting activity until the diarrhea goes away. B. Encouraging a low-fiber diet. C. Limiting sugary food consumption. D. Giving the child an enema. E. Taking calcium carbonate tablets. The answer is D. Giving the child an enema. Constipation is a common complaint in children. Encephalitis occurs when children are incontinent of fecal matter after toilet training. Often, a child will leak stools surrounding a large fecal mass that has hardened in the rectum. Giving a child an enema may help to clear the mass and restore bowel function. Constipation should be avoided through exercise, high-fiber diet, and adequate liquid ingestion. A school nurse examines a 5-year-old child who comes into the office with belly pain. The nurse palpates McBurney's point and the child winces and pulls her knees to her chest. The school nurse phones the parents to tell them which of the following? A. The child should be taken to the hospital immediately. B. The child may be experiencing reflux, spicy foods should be avoided. C. The child should be picked up and brought home. D. The child is likely constipated and will need to be seen in the office tomorrow. E. If the pain persists, make an appointment to see the physician later in the day. The answer is A. The child should be taken to the hospital immediately. Tenderness over McBurney's point, 1/3 the distance from the anterior superior iliac spine to the navel, may indicate appendicitis. This should be treated as a surgical emergency and the child should be taken to the emergency room. Other symptoms of appendicitis include nausea, vomiting, fever, and frequent soft stools. Rubella is a viral illness that commonly affects children. Which of the following is another name for rubella? A. Chickenpox. B. Measles. C. Fifth disease. D. Hand, foot, and mouth disease. E. German measles. The answer is E. German measles. All of the above are viral illnesses commonly found in children. Rubella may be referred to as German measles and is spread through droplets. The disease is generally mild, presenting with a rash that typically lasts around 3 days. Maternal rubella may spread to the fetus and cause severe complications. Rubeola, also known as measles, is highly contagious and is caused by the measles virus. Chickenpox is caused by the herpes zoster, varicella, virus. Hand-foot-mouth disease is a viral disease caused by Coxsackie virus A16. Fifth disease is caused by parvovirus B19 and presents with bright red rashes on the cheeks and other parts of the body. The nurse is caring for a 1-year-old male client who has been brought to the emergency room because his parents state that he has been more fussy than usual. He has current jelly stools and is vomiting. What may the nurse suspect? A. Intussusception. B. Umbilical hernia. C. Pyloric stenosis. D. Inguinal hernia. E. Incapricis. The answer is A. Intussusception. Intussusception occurs when a portion of the bowel is pushed into another portion. It most commonly affects children under the age of 2. Red currant jelly stools, stool mixed with blood and mucus, vomiting, and pain are common symptoms. Red currant jelly stools are a hallmark of intussusception. Pyloric stenosis generally causes reflux post-feeding, and incapricis affects children who have already been toilet trained. Hernias are rare in young patients. Incapricis refers to involuntary fecal soiling in children who are already toilet trained, and does not involve abnormal stool, such as currant jelly characterization. Which of the following is a typical clinical sign of aortic insufficiency in a pediatric patient? A. Exercise intolerance. B. Excessive sweating. C. Frequent epigastric pain. D. Mania. The answer is A. Exercise intolerance. Exercise intolerance is a typical clinical finding in pediatric patients with aortic stenosis. This condition may present with any of the other symptoms, but mania, excessive sweating, and epigastric pain are not directly associated with aortic insufficiency in this population. Parvovirus B19 causes which of the following conditions? A. Roseola infantum. B. Fifth's disease. C. Rubeola. D. Scarlet fever. The answer is B. Fifth's disease. Parvovirus B19 causes Fifth's disease, sometimes referred to as slap cheek syndrome, due to the bright red cheeks that often present with the infection. Scarlet fever is caused by group A Streptococcus infection. Roseola infantum is caused by either human herpes virus 6 or human herpes virus 7. Rubeola, or measles, is caused by the measles virus. What is the incubation period for varicella, chickenpox? A. 48 to 72 hours. B. 14 to 28 days. C. 2 to 7 days. D. 10 to 21 days. The answer is D. 10 to 21 days. Varicella, caused by an infection with the varicella zoster virus, has an incubation period of 10 to 21 days. Which of the following infections is the most common cause of hand, foot, and mouth disease? A. Enterovirus 71. B. Human herpes virus 6. C. Parvovirus B19. D. Coxsackie virus A16. The answer is D. Coxsackie virus A16. The most common cause of hand, foot, and mouth disease in the United States is Coxsackie virus A16. Enterovirus 71 can also cause hand, foot, and mouth disease, though it is a less common etiology. Parvovirus B19 causes fifth disease, sometimes referred to as slap cheek syndrome. Human herpes virus 6 is one of two viruses that cause roseola infantum. While doing a standard ophthalmoscopic exam on a 7-year-old female, the examiner notices that while the light reflex of the left eye is red, the light reflex of the right eye appears bright yellow. The right pupil is also less reactive to light, and the right eye appears to be slightly bulging. The examiner should be suspicious of which of the following conditions? A. Cataract. B. Hordeolum. C. Pincula. D. Retinoblastoma. The answer is D. Retinoblastoma. Retinoblastoma is the most common form of ocular cancer in children. It is derived from developing retinal cells. The most common symptoms are a white or yellow light reflex, also known as leukochoria, diminished pupillary reflex, crossing of the eyes, impaired vision, and bulging of the affected eye. A cataract may also cause the pupil to appear white or to produce a white or yellow light reflex, but it will not cause bulging of the eye. A pincula is a fatty deposit on the sclera which will not alter the red light reflex, and a hordeolum is outside the eye itself. It is an infection of a hair follicle of the eyelid, also known as a stye. A labor and delivery nurse is speaking to a new mother about her premature infant, and is explaining why the infant will have difficulty with heat regulation. Which of the following statements made by the nurse best explains why a preterm infant cannot conserve heat properly? A. The preterm infant has an immature hypothalamus, which cannot set the infant's internal temperature properly, leading to large amounts of heat being lost via convection. B. The preterm infant has too little protein reserves around the kidneys, the neck, between the scapulae, and behind the sternum, and therefore cannot generate heat and can lead to hypothermia. C. The preterm infant has a lack of subcutaneous fat, and a large surface area to body weight ratio, as well as the lack of brown fat that provides heat to infants due to its unique thermogenic properties. D. The preterm infant lacks white fat, which provides the infant with a heat source due to underdeveloped and the inability to utilize the process of shivering to produce heat. E. The preterm infant cannot generate heat effectively because of a lack of surfactant in the skin and therefore cannot generate or preserve a proper body temperature. The answer is C. The preterm infant has a lack of subcutaneous fat, and a large surface area to body weight ratio, as well as the lack of brown fat that provides heat to infants due to its unique thermogenic properties. A preterm infant cannot conserve heat due to several reasons. The infant has a lack of subcutaneous fat, has a large surface area relative to their body weight, a lack of glucose reserves, and a lack of brown fat, which is a unique type of fat that is capable of generating a greater amount of heat than just ordinary fat. What specific enzyme deficiency accounts for 95% of all cases of congenital adrenal hyperplasia? A. 7-alpha hydroxylase deficiency. B. 21 hydroxylase deficiency. C. Beta-glucuronidase deficiency. D. Estrogen synthetase deficiency. The answer is B. 21 hydroxylase deficiency. In 21 hydroxylase deficiency, cortisol production is reduced, which in turn causes adrenocorticotropic hormone, ACTH, to increase. The precursors for the cortisol are then shunted into androgen production since these are steroids, and are thus derived from cholesterol. The community health nurse knows that teaching has been effective when the father of a newborn states A. I will place my child on her back to sleep. B. I will place my child on her back and in a crib with stuffed animals to create familiarity. C. I will place bumper pads in the crib to prevent injury. D. My child will sleep in the bed with me until the first month of life. E. I will place my child on her side to sleep, supported by pillows. The answer is A. I will place my child on her back to sleep. Newborns should be placed on their back, in their crib, with nothing else when put to sleep. The crib may contain a fitted sheet or light blanket. Crib pads, pillows, and stuffed animals are not advised because they may interfere with the child's ability to breathe. The postpartum nurse is caring for a family and their new baby, a 2-day-old infant. The baby is spitting up following every formula feeding. The nurse may suggest A. Giving only 15 to 30 milliliters per feeding. B. Laying the baby on its back after feedings. C. Switching brands of formula. D. Increasing the frequency of feedings. E. Using a soft instead of a standard bottle nipple. The answer is A. Giving only 15 to 30 milliliters per feeding. Typically, the digestive system of a 2-day-old infant can only accommodate 15 to 30 milliliters of formula comfortably. The infant's stomach will grow considerably over the coming weeks. Frequent spitting up could be due to overfeeding. Before switching formula brands, try decreasing the amount fed at each feeding. Increasing the frequency of feedings may add to this problem. Another possibility, that the infant is feeding too fast, may be corrected by using a slow flow instead of a soft or standard nipple. Soft nipples may be helpful in infants with poor suck or latch. While feeding and directly afterwards, it is advised to keep the infant in a semi-upright position. HA therapy has the ability to positively impact children who are cognitively, socially, emotionally, or physically challenged. Which of the following therapies is most closely related to HA therapy? A. Art therapy. B. Massage therapy. C. Pet therapy. D. Music therapy. E. Herbal therapy. The answer is C. Pet therapy. HA therapy is therapeutic horseback riding for the handicapped. The motion of the horse can help the child develop flexibility and balance. Working with others and animals can help the child cross social and emotional boundaries. A therapy involving animals, pet therapy, is most similar to HA therapy. Jennifer is a 14-year-old patient who has been diagnosed with diphtheria and subsequently, myocarditis. The nurse implements all of the following except A. Practicing standard precautions. B. Enforcing bed rest. C. Administering antitoxin. D. Administering antibiotics. E. Practicing airborne precautions. The answer is E. Practicing airborne precautions. Diphtheria is an illness caused by bacteria, Green Bacterium diphtheriae. It is spread through droplets, requiring droplet precautions. Standard precautions should also be used, as with any patient. Delivery of antitoxin and antibiotics are important to a patient's recovery. Enforcing bed rest is important after a patient has developed myocarditis, inflammation of the heart. A community health nurse is giving a presentation on pertussis, whooping cough. He tells his audience that which population is most at risk? A. Older adults above 85. B. Older adults from 65 to 75. C. Older adults from 75 to 85. D. Children under 4 years of age. E. Children from 4 to 12. The answer is D. Children under 4 years of age. Children under 4 years of age hold the greatest risk of contracting pertussis and developing serious complications, including death. Pertussis vaccines are recommended for all age groups. Children can start a vaccination series as early as 2 months of age. New parents are encouraged to become vaccinated before their baby arrives to prevent transmission before the infant is eligible for immunization. A room designed to accommodate a child with the measles should include which of the following? A. Negative air pressure. B. Low microscopy pressure device. C. Positive air pressure. D. No air pressure device is necessary. E. High microscopy pressure device. The answer is A. Negative air pressure. Measles is an airborne illness. For that reason, air pressure devices are necessary to prevent the spread of infection. Negative air pressure devices will adequately contain the measles virus because air will flow into the room as opposed to out. Conversely, positive air pressure devices may be used to create an airflow out of a room in severely immunocompromised patients. The school nurse is approached by a 9-year-old boy who is complaining of severe scalp pruritus. Upon closer examination, the nurse concludes that he has a case of head lice, pediculosis capitis. She knows all of the following to be true except dash. A. Treating the clothing of the child may be necessary. B. His personal grooming items should be soaked in hot water or shampoo. C. Sealing his backpack in a plastic bag for 10 days should kill the lice. D. His 5-year-old sister should be examined. E. Head lice may be a sign of poor hygiene. The answer is A. Head lice may be a sign of poor hygiene. Children and adults with exceptional personal hygiene are equally affected by head lice. The same applies to people of all socioeconomic groups, genders, and nationalities. All of the other options are true nursing interventions for head lice. A school nurse is holding a question and answer meeting for parents following a recent outbreak of scarlet fever. Which of the following would the nurse confirm is false? A. Scarlet fever is transmitted through the air. B. Children over 2 years of age are higher risk than children under 2 years of age. C. Scarlet fever is a viral infection. D. A rash develops secondary to toxin sensitivity. E. A child may or may not develop a rash after exposure. The answer is C. Scarlet fever is a viral infection. Scarlet fever is a bacterial infection caused by group A Streptococcus that is transmitted through the air. Children who are sensitive to the bacterial toxin may develop a rash, although some will not. Infants and toddlers under the age of 2 are rarely seen with the disease.